U.S. COVID-19 cases rise in West and South, plus European Chikungunya and Dengue updates. As COVID-19 continues to evolve, a slight uptick in cases has been observed across various regions in the United States, particularly in the West, South, and Southeast. According to the latest updates from the Centers for Disease Control and Prevention, CDC, while the overall activity remains relatively low, there are signs of increasing infections that warrant attention. This rise is primarily indicated by early warning signs, such as the number of emergency department visits related to COVID-19. Although these visits are still minimal on a national scale, currently sitting at just 0.5%, there has been a notable increase of 10.9% compared to the previous week. This surge is particularly pronounced among young children aged 4 and under, highlighting a demographic that may require closer monitoring. Additionally, the national test positivity rate has seen a slight increase, now at 4.8%, which is up by 1.1 percentage points from the week prior. In another concerning trend, wastewater analysis, a crucial early detection method, has shown rising levels of SARS-CoV-2 in several states. Earlier this summer, these levels were quite low, but they have now returned to a low level, with the highest concentrations found in states such as California, Florida, Hawaii, Louisiana, Nevada, South Carolina, and Texas. Interestingly, the CDC has not updated its projections regarding the proportions of COVID-19 variants since mid-June, citing a lack of reported sequences. The last available data indicated an increase in newer subvariants, including NB.1.8.1 and XFG, which could have implications for public health strategies moving forward. In a related note, European countries are also facing challenges with mosquito-borne diseases. Italy has reported its first local case of chikungunya since 2017, occurring in the Piacenza province of the Emilia-Romagna region. This marks a significant event, as Italy becomes the second country on the European mainland to report local chikungunya cases this year. France has also confirmed 30 cases across 12 different regions, with the largest cluster of 13 cases identified in Salanda province, located in the southern part of the country. Moreover, both France and Italy have documented their first local dengue cases of the year, with France's case emerging from the Loire Valley and Italy's from Bologna province. Earlier in January, Portugal reported 2 dengue cases in Madeira, which the ECDC suggests may have involved transmission that could extend into 2024. To address these rising concerns, the ECDC has recently launched a new series of updates focused on mosquito-borne illnesses and has published guidance aimed at tackling locally acquired mosquito-transmitted diseases across Europe. As we navigate these developments, it's crucial to stay informed and engaged. What are your thoughts on the rising COVID-19 cases and the resurgence of mosquito-borne diseases in Europe? Do you believe that public health measures are keeping pace with these emerging threats? Share your opinions in the comments. COVID-19 cases rising in 26 states amid summer wave. Brace yourself. COVID-19 is making a summer comeback, and it's gaining ground faster than many expected. But here's where it gets controversial. Some experts believe these off-season surges are here to stay, yet others argue we should focus on declining deaths rather than rising cases. And this is the part most people miss. Even if overall fatalities drop, vulnerable groups can still be hit hard. CDC warns COVID cases are on the upswing. The U.S. Centers for Disease Control and Prevention, CDC, has reported a clear upward trend in COVID-19 cases across many parts of the nation. Their most recent data suggests that in at least 26 states, as well as Washington, D.C., cases are either growing or are likely to grow soon. What's more, emergency room visits tied to COVID-19 have jumped, especially in younger children, reportedly reaching the highest level since March. This shift has led CBS News chief medical correspondent Dr. John Lawpook to remind us that summer spikes are by now an established pattern. "We've seen it each year," he said. "There's always a winter spike, and then we typically see a summer spike. The good news is that each year, hospitalizations and deaths have gradually decreased. But that doesn't mean we should ignore the climb in infections." So what does ignoring these spikes actually mean? According to Dr. Lawpook, that can be risky, especially for populations at higher risk. Those over age 65, very young children, and people with compromised immune systems can still become seriously ill. Some families might assume downward trends in deaths are enough reason to let their guard down. But for individuals who are especially vulnerable, a COVID infection could still pose a significant threat. New COVID variants, Nimbus and Stratus. Dr. Lawpook also mentioned two fresh COVID variants on the radar, sometimes nicknamed Nimbus and Stratus, though he emphasized they appear to be no more deadly than older variants such as NB.1.8.1. From what experts have seen so far, symptoms are quite similar to earlier strains. Respiratory discomfort like coughing or throat irritation, and systemic issues like fatigue and fever. A positive note is that the recently developed vaccines reportedly cover these newer variants. "That's good news," Dr. Lawpook said. "However, this doesn't mean summer gatherings are completely risk-free. It's still wise to stay alert." Should you get a COVID booster now? The CDC continues to maintain that the COVID-19 vaccine can guard people from severe illness, hospitalization, and even death. Yet the guidance around who should get boosted right now has been a bit confusing. For instance, the American College of Obstetricians and Gynecologists recommends vaccination for pregnant women, pointing out that babies rely on the mother's transferred immunity until they are old enough for their own shots. According to Dr. Lawpook, new approaches to vaccination may not be one-size-fits-all. Health and Human Services Secretary Robert F. Kennedy Jr. said it's now more about shared decision-making, meaning people should talk to their health care professional. This is a subtle change from the all-out, blanket recommendation we saw earlier. In fact, the CDC has currently adopted a shared clinical decision-making stance for healthy children. It still strongly advises most adults over 18 to get the 2024 to 2025 COVID-19 vaccine, especially if they are 65 and older, have never received a shot before, or face a high risk of severe COVID-19. Where COVID-19 cases are growing. According to the CDC, these states are recording clear growth in COVID-19 cases. Arkansas, Hawaii, Illinois, Iowa, Kentucky, North Carolina, Ohio, Pennsylvania, Texas, Virginia, where COVID-19 cases are likely growing. Meanwhile, the CDC suspects the following locations could experience an increase: Alaska, California, Delaware, District of Columbia, Georgia, Indiana, Maine, Maryland, Massachusetts, Michigan, Mississippi, New Jersey, New York, Oklahoma, South Carolina, Tennessee, Wisconsin. Who's behind the story? This information was compiled by reporter Sarah Moniesko, who covers health and lifestyle topics at cbsnews.com. She has extensive experience reporting on wellness issues, beginning with her time at USA Today, where she helped launch the newspaper's wellness vertical. She now writes on breaking and trending health news for CBS News Health Watch. A final thought. Here's a question that sparks debate. Should we be more worried about these summer surges, or trust that lower death rates imply a milder season overall? Some believe it's all about maintaining personal responsibility and avoiding panic, while others feel we should ramp up measures to protect at-risk groups. Do you agree with one side, or do you have a different take entirely? Share your viewpoints. Your observations might just help someone navigate the next steps in this ever-evolving pandemic. Summer COVID-19 surge. Experts warn of rising cases. A new wave of COVID-19 infection seems to be underway this summer, signaling what experts are describing as the beginning of a surge in cases. Epidemiologists and health officials are closely watching recent figures from the Centers for Disease Control and Prevention, CDC, which suggest that the number of new infections is starting to climb again after a period of relative stability. But here's where it gets controversial. Some experts argue this seasonal rise might be driven by factors beyond just increased social gatherings or travel during the warmer months. For example, changes in the virus itself, fluctuating vaccine effectiveness over time, or shifts in public behavior may all be playing a role. And this is the part most people miss. While many assume summer weather naturally reduces viral spread, the data are increasingly showing that summer spikes are very much possible, challenging earlier pandemic assumptions. Health authorities are now urging individuals to stay vigilant, especially in areas where hospitalizations show an uptick. This development raises important questions. Are we prepared to handle another surge so soon? Could different strategies, like updated vaccines or renewed masking recommendations, help mitigate this trend? Let us know what you think. Do you believe this summer's rise in COVID cases is just a temporary blip, or are we facing a more significant challenge that demands immediate attention?